Hello friends, this is me Zubair Ahmad and welcome to my channel Learn and Live MD. And today I am going to discuss something important with you like what is USMLE, what is match and how that whole process works. Actually from the area where I belong to, most of the students do not know actual path of USMLE. Even they have little bit idea but they are not clear about actual path, that how that whole process works and what steps we have to take. So actually USMLE is United State Medical Licensing Exam. So it means if you are appearing in that exam, you are trying to get license for United States. Give me a simple example to you, like if you are driving and you are getting driving license, so that means you are allowed to drive in your country, your state, anything. Or one more thing, let me explain you that if most of our students go to China, Russia for their medical studies like for MBBS, and when they come back to Pakistan they have to appear in the medical license exam of PMDC. So after that exam they are eligible to work here in Pakistan. So in the same way, after USMLE exams we will be eligible to work in the United States. So USMLE has four exams, basically three medical related and one English. So these are step 1, step 2, OET and step 3. Step 1 exam consists of 8 hours duration, step 2 consists of 9 hours duration, OET it is almost 4 hour duration, and step 3 is based on 2 days. One day of 7 to 8 hours and second day of 9 hours duration. So in step 1 there are mostly basic subjects like you from your first year, second year, third year and fourth year. And step 2 you have to appear for your final year exams like medicine, surgery, gynae, ped, psychiatry. So that's all. OET is your English exam, occupational English test. So basically it used to be step 2 CS exam, clinical skills, for which we have to go to US and appear in that exam. But after COVID year, they have changed the rules and they have cancelled the CS exam because of most of the visa issues. Now they have started OET exam. And step 3 is also clinical exam. So it has BCQs as well as CCS cases. So best time to give step 1 is your fourth year or final year of medical school. Actually step 3 is not needed for match. So we can sit in that exam after our match process, but nowadays most of the programs are demanding step 3 for match. So these are the exams you have to take for USMLE exam. So if you are done with your USMLE step 2, step 1, step 2 and OET, you are eligible for ECFMD certification. If you are once you are done with your ECFMD certification, there is the pathways like you have to apply for good standing, then pathway, and after approval of pathway you will receive a certificate of ECFMD certification and then you can call yourself as MD. So step 3 is not needed for that. So besides these 3-4 exams, what you have to do for match? You have to do United States clinical experience. You can say it electives, US clinical experience like USCI. Although these are little bit different things, but you have to get LOR from US. So they will help you in your CV format process. And what is match? Like most of you guys know, this man has matched in internal medicine, this man has matched in neurology, anything else. So what is match? Actually, match is a process in which you guys apply for your residency into different programs. And if you are lucky enough, you will get interviews, and at the day of result, you will be announced as successful that you are matched. Or if you are unlucky, so you will be declared as unmatched. So that is the process of applying residency. That process starts from mostly June, July, because they open ERAS tokens at AMC ID. You can buy your ERAS token, and after ERAS token, you have to fill your application, and that you have your personal, your clinical experiences, your LORs, your MSP, all the things which documents are needed. And in September, there are almost 20-25 days gap, that in that gap you can submit your application to the ECFME. So mostly last date occurs in 20th of September. So from after submission of your application, programs start reviewing your application, and if you are good enough, they will provide you interview, and interview season begins from October 1st or mostly from second week of October. November and December are the peak seasons for interviews, and that whole process lasts for February, like February. So, in the last week of February, you have to submit another list on the NRMP. For example, if you got 5 interviews, you have to give the list that this is my first option, this is my second, this is third, this is fourth, and this is fifth option. So they will consider you if program has ranked you. So they will match you. If you are matching with your first, they will provide you first option. If you are matching with your second, they will provide you second option. So in that way, and the result of match comes in almost in the mid-March, like second or third week of March. And that is the whole process of match, how it works. So after matching, if you are matched, after a few time, like 2-3 weeks, the university will contact you that congratulations, we welcome you to our university, this and that, and your visa process begins, whatever that is, either J1 or H1B. So if you are like doing, it is same as you are doing FCPS here. You will be paid for your residency, but the duration is different. Like internal medicine general in Pakistan has 4 years, and in US it is of 3 years. And same as neuro, which is of 4 years, and others like you can apply in your base like internal medicine, neurology, PV, psychiatry, surgery, general surgery. These are the options where you can. But most of the IMGs apply in internal medicine because that is competitive and that's easy to get from others. They have the good chance. So if you are done with internal medicine and you are made, so you have to stay for 3 years for your residency. In Pakistan, we have to give exam, like we call it FCPS Part 2 after our residency, but in US that is not so. We do not have to give any exam in US after completion of your residency. But we have to appear in exam every year, we call it boards exams, and that are easy enough to pass. But in FCPS you have to appear in your IMM, then Part 2, 3D, and Viva. That's difficult enough in my sense. So let me tell you some durations of different programs, like your anesthesiology consists of 3 years plus 1 prelim. So we have 2 options in match process, either prelim or categorical. So prelim, that means 1 year of internal medicine or general surgery, anything. So prelim consists of 1 year, and categorical, that means of whole 3 years. So most of the candidates apply for categorical because you have to finish your residency. If you are made in prelim and you applied in prelim, so that means you will get residency for 1 year, and after that next year you have to apply again for either PGY2 or PGY1 again. So that is the concept of prelim and categorical. Most of the students get confused in that too. Derma, consists of almost 4 years, emergency medicine 3 to 4 years, family practice 3 years, general surgery 5 years, internal medicine 3 years, neurology 4 years, neurosurgery 7 years. It is lengthy and difficult to get matched there. Ops gynae 4 years, eye 4 years, orthopedic surgery 5 years, ENT 5 years, pathology 4 years, pediatrics 3 years, physical medicine 3 to 4 years, plastic surgery 6 years. It is also lengthy and difficult. Psychiatry 4 years, radiation oncology 4 years, plus 1 year of prelim you need it. And urology consists of 5 years. So these are the specific length of your residency periods. Like if I am majoring in internal medicine, I have to do residency for only 3 years. So after finishing training, then you have two options. Either get job as hospitalist or internist. So that means you will perform there as a general physician, in simple words, like in Pakistan. But we call it hospitalist if he or she is doing in the hospital, and internist if he or she is doing in clinic work. Option 2, you can continue your fellowship, like subspecialty. Like if you are interested in cardiology, oncology, there are many fields of internal medicine, so you can continue in them. So that has also the same process. You have to apply for fellowship match program. You will receive interviews, and if you are lucky enough to get matched, you will be successful, and your result will be announced, and you have to do training whatever the period of that is. Like general cardio is of 2 years, and if you want to do the interventional cardiology, it is 1 more year extra. Like then it will take whole 3 years. If you are doing in him and onco, it is of almost 3 years. So there are different subspecialties like addiction medicine, adult congenital heart disease, advanced heart failure and transplant cardiology, cardiovascular disease, critical care medicine, endocrinology, gastroenterology, geriatric medicine, hematology, heme and onco, like nephro, pulmo, and rheumatology, sleep medicine. A lot of things are there you can apply. So that is the whole process of MAGE and USMLE. And one more thing I would like to share, this is for especially those candidates who are already done their residency in their home country. So they can apply directly to subspecialty if they have finished their at least 3 years, or some require 2 years of program. And if they are require 2-year program, they will count 3rd year as your house job. So in this, you have to give your exams, step 1, step 2 OET, and step 3, and then you can apply. So there are little specific fields where there are great chances, and you can apply like nephro, infectious disease, and geriatric medicine. So if you are done with 3 or 2 years of residency, you can apply in these programs too directly without going into residency program. So that's whole about the USMLE and MAGE process. If you have any question, you can comment below, and in the next video I will tell you about estimated cost of USMLE, like your step exams, like your clinical experience, fees of your MAGE, that whole things I will calculate, and will try to clear your concept about that so that you can make your mind. And thank you so much for listening this video. Please do not forget to like, share, and subscribe my channel Learn and Live MD. Thank you once again.